All right, we are now recording. This is the first lecture that we are going to have on the urinary system. On this slide is a summary of course objectives. By the time we are done talking about the urinary system, you should be able to talk about these bullet points. So the urinary system is found in the retroperitoneal space. That is worth knowing. Retroperitoneal space. It is found in the abdominal pelvic cavity, meaning you've got to be inferior to or below the diaphragm. And then specifically in the retroperitoneal area of the abdominal pelvic cavity. That's really important because the anterior side of the abdominal pelvic cavity is where the digestive organs will be found. These digestive organs will have peritoneum, which is one of the serous membranes we talked about surrounding these organs of the digestive system. The peritoneum is only found in the anterior side, and so anything behind where you would find the peritoneum, anything behind the digestive system is called the retroperitoneal area or retroperitoneum, retro meaning behind the peritoneum, and the urinary system is a retroperitoneal system. There are two kidneys. You only need one to survive, but most individuals are born with two kidneys, a right and a left. One urinary bladder, and like we talked about for the gallbladder, in that it's only a storage vessel, same concept applies to the urinary bladder, except that it stores a very different fluid, urine, whereas gallbladder, if you recall, stored bile. Nothing's made in the urinary bladder, just like nothing is made in the gallbladder. So the urine that the urinary bladder stores is made in either the right kidney or left kidney. So one of the main functions of the kidneys is to filter out the blood to produce urine. With that being said, there are two sets of tubes, if you will, that connect the kidneys to the urinary bladder, and then a tube that connects the urinary bladder to the outside world so that urine that's being stored can properly exit the body. There are two ureters, one for the left kidney and one for the right kidney, right here. And then there's one urethra, which is an inferior structure to the urinary bladder. So it's not on this slide, but it does exist. Another piece of anatomical information that is worth knowing is that the kidneys are actually not at the same level in the abdominal pelvic cavity. One would think, right? But they are not. The left kidney is about 2 to 3 vertebral levels higher than the right kidney, because in the right upper quadrant, you find the liver. And the liver, as you saw, because we just talked about the digestive system, is a pretty huge organ, takes up quite a bit of space, thereby pushing the right kidney down a couple of vertebral levels below the left kidney. The urinary system is one of the excretory systems of the body. Sometimes we refer to these as one of the emunctories, so ways in which the body can expel toxins, release waste and toxins from the body. Skin was one of them. So when you sweat, that's why sweating can be a good thing for you. And that's why we encourage patients to exercise, because in addition to increasing your heart rate and making sure your heart is nice and strong, it also increases the chances that you will sweat, which will allow you to release some of these toxic wastes through the sweat. Lungs are another excretory system. The large intestine, because of the production of feces in the process that we learned as defecation, and that brings us to the urinary system. So the urinary system is a really important system for filtering out the blood. That is key. That's what the kidneys do. The kidneys will filter the blood to produce urine, which is why it's important that we are able to urinate frequently enough throughout the day so that we can regularly expel toxins and waste from our body. This is the issue. This is the concern that we have for patients who are in kidney failure. So essentially in kidney failure, they cannot filter out the blood, meaning they cannot properly eliminate toxins from their body, which can easily lead to widespread infections and possibly toxic shock. For this reason, these patients are often recommended for dialysis, which is a big commitment. I mean, you're going at least 3 times per week. You're there for 2 hours a session. It significantly changes a person's way of life and quality of life, one can argue. So the kidneys is really something you want to protect as much as possible, because once you lose function, it is hard to get back. It is hard to get back. So couple of notes about the ureter and the urethra, often mixed up by students. Why? Well, because the first 4 letters are exactly the same, U-R-E-T and U-R-E-T here. So do whatever you need to do to make sure you can identify the difference and know the difference. Especially, this becomes an issue for, if you overlook it or read the question too fast or read the options on the multiple choice question too fast, you might miss it. So if it helps at all, urethra is an article that you use in the English language to indicate one of something. And there's only one urethra because there's one urinary bladder from which that urine can exit. There's 2 ureters, one for each kidney, right and left. Jomana, did you have a question for me?
I did. I was going to ask, is the reason why people can live with 2 kidneys is essentially because of the fact that only one works at a time? So yes, we have 2, but realistically, only one of them works at a specific time?
Ooh, that's a great question. My understanding is that both are filtered for as long as both can filter, both will filter, but it is enough. Like one kidney can filter out the blood because of, you think about the way the circulation is set up, for as long as blood can enter that kidney, at some point, all the blood in your system will pass through that one kidney. Did I answer your question?
Yeah, you did.
Wonderful. That's a great question. Thank you for bringing that to my attention. All right, let's move along here. To the 5 homeostatic functions of the urinary system. So I won't belabor these. I think that the slides do a really good job of outlining why. The urinary system is involved in helping maintain homeostasis in the body. Mainly, partly because it is involved in regulating blood volume and blood pressure. So remember that how much water is in the blood can strongly influence blood pressure. There's more water retention, there's going to be a higher chance that you're going to see higher blood pressure. So because the urinary system, particularly at the kidneys, which is filtering out the blood, and part of what we're regulating is the amount of water in the blood, we can change blood pressure by changing how much water is filtered out from the blood at the level of the kidneys. And there are several medications on the market right now that are designed to treat hypertension with a mechanism of action focused on the kidneys. As part of filtration, the kidneys are also involved in regulating plasma ion concentrations, namely sodium, potassium, chloride, and calcium. So these specific ions have certain physiological responsibilities. For example, sodium and potassium are involved in the action potential of neurons, which you find in the nervous system. Also, in cardiomyocytes, which we talked about as part of the circulatory system. And then calcium levels, we've talked about in our discussion of the endocrine system, how important it is to regulate calcium ion levels in the blood. Too much is no good, too little is no good either. Calcium levels are also responsible for the plateau in cardiomyocytes, which helps regulate how often the heart can beat. Now, if you revisit the hormones that are involved in calcium regulation, the parathyroid hormone, one of the organs it acts on is the kidneys. So this is a great time to put 2 and 2 together and realize and really appreciate how the body is comprised of multiple systems working with one another. If you recall, when we talked about blood can only be, well, blood in a healthy human needs to be at a pH of 7.4. It can alter by about 0.2 pH points. So it can go down to 7.2, 7 and go as high as 7.6 without significant ramifications. Anything beyond that will start to pose some challenges for other systems in the body. Because the kidneys filter out the blood, including ions such as hydrogen and bicarbonate, then it explains why the urinary system can influence blood pH. So essentially, between the lungs, where we can control how much carbon dioxide remains in the lungs by how frequently we're breathing, how frequently our respiration rates are or not. Remember that carbon dioxide gets quickly converted to carbonic acid by carbonic anhydrase in red blood cells, thereby making carbon dioxide a significant contributor for hydrogen ions in the blood. It is balanced out by the way the kidneys regulate hydrogen ion and bicarbonate ions in the blood because of how well the kidneys are filtering it out. The urinary system will conserve valuable nutrients. That one is probably the most self-explanatory. And then it assists the liver with detoxifying poisons, toxins, if you will. Medications can fall in this category, especially if it's the wrong dose is taken or it is improperly administered. So, with that being said, this is why we strongly discourage patients from changing their own dose of medications. Sometimes patients do that, believe it or not. And we have a conversation, or I can't speak for everybody, but I have a conversation with my patients about the harm of doing that. Really what it comes down to is pharmacokinetics and pharmacodynamics. So unless you know how well or how often this certain medication is excreted through the kidneys at the level of the nephrons, you really shouldn't be tweaking your dose of medication, because in an effort to feel better, you might actually make yourself feel worse because you weren't feeling anything. You increase the dose and then you end up being in an overdose because your kidneys weren't properly excreting the medication. I saw another a hand go up. Jumana, do you have a question for me?
No, sorry. I think my hand's just still up. I need to remove it.
Okay, I just wanted to make sure. Well, let's do a quick review of macroscopic structure then. I hope you saw a kidney in cadaver. It's actually pretty fascinating. One of them should have a frontal or coronal incision so that you can see this view. There are two regions to the kidney. Similar to in the adrenal glands, you had a cortex and medulla. The kidney also has a cortex and a medulla. These purple, pink triangular structures are the renal pyramids. In between the renal pyramids here, here, and here, just to name a few, are the renal columns. The renal columns, and renal pyramids are structures that are found in the region that is the renal medulla. Okay, in between the renal medulla and the outermost, this capsule, this brown fibrous capsule, which keeps the kidney together, is the renal cortex. And most nephrons, which is the basic unit of kidney function we'll talk more about later, are set up or arranged in such a way where the glomerulus of the nephron is situated in the cortex. And so we refer to those nephrons as cortical nephrons because most of the nephron begins in the renal cortex. With each nephron is a collecting duct. By the time urine reaches the collecting duct, there's really not much we can alter about it, except for how much water is coming out with the urine. The collecting duct is designed to collect all the urine that's formed from the millions of nephrons that are found in the kidney, and they drain into these minor calyces here, here, and here. 2 to 3 minor calyces come together to make a major calyx, and then all the major calyces here, here, and here come together to create the last stop that urine will make in the kidney before it goes down the ureter to be stored in the urinary bladder. This last stop is known as the renal pelvis. Please do not confuse the renal pelvis with the renal hilum. The renal pelvis is a structure within the kidney. The renal hilum is an opening space within the kidney through which the renal pelvis will be found. Just like the hilum of the lung. When we talked about the lung, there's a pleural cavity, and you need that pleural cavity to be intact in order to drive inspiration and expiration, essentially breathing. If it's broken, it cannot inflate and deflate to bring air in and out of the lungs. So in the lung, the only place airways, arteries, veins, nerve, and lymphatic vessels can enter the lung is through the hilum. Same concept with the kidney. The only place the renal artery, renal vein, and all the nerves and lymphatic vessels that need to go to the kidney, they will enter only through the renal hilum, which will always be medial in anatomical position. Always be medial in anatomical position. So on many models, you will see in the renal hilum, the renal artery in red, the renal vein in blue, and then the renal pelvis, which is the last stop that formed urine will make before it goes down the ureter to the urinary bladder for storage. The kidneys are a very vital organ. I think we can agree with that statement. For that reason, there's several layers of protection. It is generally a soft, it's not very good at withstanding a whole bunch of impact. So there are structures around it to help keep it together and to help absorb any sort of impact. So we've already seen the renal fibrous capsule. It's the most immediate layer of collagen fibers, so essentially connective tissue around the renal cortex. Outside of the renal fibrous capsule is a fatty capsule, basically a layer that surrounds the kidney that's made of adipose tissue. This adipose is really good at absorbing shock absorption. So it's one of the reasons for why it's there. And then surrounding the adipose capsule is the renal fascia, a dense fibrous outer layer. This is really important for anchoring the kidney to surrounding structure so that it's not really moving in the retroperitoneal space. That would obviously be problematic. All right, so we've talked about all these structures already. Let's talk about the renal papilla. The renal papilla is the most proximal tip of the renal pyramids with respect to the renal pelvis. This is essentially the last bit of renal pyramid that collecting ducts will see before they dump their contents, essentially urine that's being formed into the minor calyx. Now, with respect to the papilla, please understand that the renal papilla is still part of the renal medulla. That's often missed for reasons I'm not quite sure, so I'm making it known to you. And then the minor calyx is part of the collecting duct system. And that is the end of slideshow number 1. Is there anything I can clarify for anybody? Wonderful. Well, give me a second here to pull up slideshow number 2. So in this, excuse me, a second PowerPoint file, we will focus on how blood flows throughout the kidney, and then we'll see for the first time the role, something called renin, and the Juxtaglomerular Apparatus that it comes from, which will help the kidneys sense and contribute to any changes in blood pressure that the body may need to undergo to help maintain homeostasis. So on this slide is a really neat a summary, bottom right hand of the slide. This is really, really helpful. I would actually spend some time on this slide and know the order in which blood will flow throughout the kidneys. So something I want to point out right off the bat, because this tends to confuse a lot of students. When we talk about the nephron, we'll talk about something called the glomerulus, which is essentially a capillary bed, because there will be some diffusion across the epithelium of the glomerulus. Now, that you'll see is always labeled in red because the oxygenation level doesn't change. We're not doing gas exchange at the nephron. Again, I repeat, we're not doing gas exchange at the nephron. So when we get to the glomerulus, there's going to be an arteriole, which is simply, if you recall, a small artery, one to bring blood to the glomerulus for filtration, and one to help blood leave the glomerulus after filtration by the nephron. So A comes before E in the alphabet. That's also the order in which the arterioles are found with respect to the glomerulus. Both are going to be arterioles because, again, there's no gas exchange, no oxygen has been given off, and no carbon dioxide has been received. We are not doing gas exchange at the glomerulus. So because we've identified, or what I hope you found, the renal artery and renal vein in lab, relatively easy to find because each kidney has its own. The renal artery will be a direct branch of the abdominal aorta to bring oxygenated blood. I repeat, oxygenated blood. That's why it is a red vessel to the entire kidney. Now, two things need to happen at the kidneys. One is the blood needs to be filtered. And then two, of course, to keep kidney tissue alive, it needs oxygen. So the renal artery is delivering blood to the kidneys for two reasons. The renal artery will direct blood into one of these segmental arteries, which will start distributing blood throughout the kidney. And then that will branch out into interlobular arteries, which will travel through the renal columns, and then the arcuate arteries. The arcuate arteries are found on the superficial side, I'd say, of the renal medulla, right where the renal pyramid makes contact with the renal cortex. And then from there, remember, a lot of nephrons are cortical, meaning most of it is situated in the renal cortex, like so here in purple. So in an effort to bring blood to the glomerulus for filtration, which is one of the main roles the kidney has, from the arcuate arteries, they branch out into cortical radiate arteries. And then from there, they branch off to become the afferent arterioles, and that's what will feed the capillary bed that is called the glomerulus. That is where filtration of urine will occur. Filtration of blood to make urine will occur. Remember, no gas exchange has occurred here at the glomerulus, just filtration of blood to make urine. So when blood leaves the glomerulus, it leaves by way of the efferent arteriole, also an artery and also in red because no oxygen has been given off. This then brings blood to the peritubular capillaries. They're called the peritubular capillaries because they're going to surround the renal tubule. And we will define later on in one of these slides, the renal tubule is segmented into three sections you may have already heard about in lab. They are the proximal convoluted tubule, the loop of Henle, and the distal convoluted tubule. These peritubular capillaries are going to be really important for the reabsorption of nutrients at the PCT, proximal convoluted tubule, as well as the secretion of toxins at the distal convoluted tubule. More on that later. Now, also at the peritubular capillaries, you are going to have gas exchange. So this is where the cells that belong to the kidney, the nephrocytes, will get oxygen to keep them kicking, right, to keep them alive. And they will also put out or give off carbon dioxide to start venous return to the inferior vena cava so that it can return to the right atrium of the heart. So from the peritubular capillaries, they drain into venals, then the cortical radiate veins, then arcuate veins and interlobular veins found right next to the respective arteries. And then, of course, the renal vein, which will drain directly into the inferior vena cava. So keep in mind as you're learning about the kidneys that we're bringing blood to the kidneys for two reasons. One is to give the kidneys oxygen and blood, and the other is to drive blood to the kidneys for filtration. Here is this big word that begins with an N, nephron. Know it, love it. It is the structural and functional unit of the kidney. So when we ask, what is the basic unit of kidney function? Nephron is the best answer. It has a renal corpuscle and a renal tubule, and each nephron is set up with a collecting duct. There's a million nephrons per kidney, and each is doing its little parts to filter out the blood to make urine. So in purple is the nephron, which is comprised of the renal corpuscle and the renal tubule, which are the three sections I mentioned before: the proximal convoluted tubule, loop of Henle, and distal convoluted tubule. So these tubules are named based with respect to how close they are to the renal corpuscle. So because this first segment is closest to the renal corpuscle, this is the proximal convoluted tubule, and then further away is the distal convoluted tubule. In a nutshell, as blood is being filtered at the glomerulus, the only requirement we'll talk more about later is, are you small enough? Are you small enough to pass through this filter that exists at the renal corpuscle to enter the renal tubule? Are you small enough? Glucose is certainly not small enough. So this is why it is really helpful. It's a really useful screening tool, cheap and easy. It doesn't require a needle. When we are managing patients with diabetes, we should be asking them to pee in a cup so that we can do a quick urinalysis, really easy test, cheap as well, if I didn't mention that already. And we look for the presence of glucose. We look for the presence of glucose in the urine. If we see glucose in the urine, that means the filter is broken, or the filter is not doing a good job of filtering what it's supposed to out. It's letting more out, like bigger molecules, like glucose. And so we would be able to detect glucose in the urine of diabetic patients who are just frankly not managed properly. So again, in the healthy individual, the only requirement for you to pass into the renal corpuscle is, are you small enough? Then you will make your way through the renal tubule and its three sections, and then you will eventually reach the collecting duct. Now, when you are part of the renal tubule, the contents of the forming urine can change significantly. It will look different at the PCT when compared to the loop of Henle, when compared to the DCT. This renal tubule is really important in determining the components of urine. Once urine that's being formed makes its way to the collecting duct, the only thing that can change now is how concentrated the urine is. Because the only substance that's moving through across the collecting duct lining is water. So The collecting ducts will all come together to drain into the minor calyx and then the major calyx and then the renal pelvis, and then down the ureter it goes to be stored in the urinary bladder. Let's hone in on the renal corpuscle. So there are three components to the renal corpuscle. The renal corpuscle includes the glomerulus, which is a capillary blood. This is essentially blood vessel. And then this capsule, this clamp, if you will, that's wrapping around the glomerulus. This is Bowman's capsule, also referred to as the glomerular capsule because it's wrapping around the glomerulus. There is a small space in between the epithelium of the glomerulus and the epithelium of the Bowman's capsule, the glomerular capsule. This space is called the capsular space or Bowman's space. This is where filtrates, so substances that are small enough to be filtered out of the blood, this is the space that they will pass through to make it into the nephron. So again, the renal corpuscle is what begins the nephron. It includes the Bowman's capsule, also known as glomerular capsule, and the space in between the capsule and the glomerulus, which is a capillary bed. All right, so here is a good, helpful zoomed up schematic of the renal corpuscle. Nothing new I need to add here, though at some point we're going to talk about these structures, these podocytes and fenestrations that contribute to the filter. So just keep that in mind, and we'll talk about it more towards the end of this slide set. In lab, you should have seen several histology slides. Of the kidney, we know we're looking at kidney because you'll see a glomerulus that is surrounded by a white space. This represents Bowman's space, and then simple squamous epithelium to mark the Bowman's capsule. We want simple squamous epithelium because it's going to make it easier for filtrates from the blood to easily enter Bowman's capsule. The glomerulus is a specialized capillary bed of fenestrated capillaries. I would know that, fenestrated capillaries. This allows for filtration of blood to make urine. Typically, the afferent arteriole is smaller than the efferent arteriole. So basically, there's more diameter for blood to enter the glomerulus than there is to leave the glomerulus. What that does is essentially slow down blood flow so that it provides some time for filtration of what will be urine particulates to occur at the renal corpuscle. Now the juxtaglomerular apparatus. So the juxtaglomerular apparatus is important because it produces the enzyme renin. And renin we'll talk more about as the renin-angiotensin-aldosterone system. More on that later. Just keep in mind that the juxtaglomerular apparatus is an endocrine structure that secretes the enzyme renin. Now, the juxtaglomerular apparatus is formed by juxtaglomerular cells, which are found in the smooth muscles of the arterioles leading and leaving the glomerular caps, the glomerulus, and then the macula densa, which is found in the distal convoluted tubule. You really need both of them together, and there's this communication that occurs between the macula densa cells of the distal convoluted tubule and the juxtaglomerular cells that essentially are found near the arterioles that bring blood to and away from the glomerulus. Essentially, what the juxtaglomerular cells are sensing is how much blood pressure, how much force of blood is coming into the glomerulus. It's a sensing system. And so when it is not sensing, when it senses a decrease in blood pressure, meaning maybe because there's less blood coming to the afferent arteriole, that's when it will make the enzyme renin. And then as preview, renin will essentially, because it's an enzyme, catalyze the metabolism of angiotensinogen, which is a protein that is made and secreted by the liver. More on that, I believe, in the next slide set. Let's talk about filtration. So here we're going to revisit the whole concept of fenestrated capillaries. So fenestrated capillaries is a phrase that we should be associating with the glomerulus in the renal corpuscle. So filtration only occurs in the renal corpuscle. With enough, we need is enough blood pressure for enough blood to properly enter the glomerulus so that filtration occurs. It's one of the reasons for why the Juxtaglomerular Apparatus is around the arterioles, so that if there's a decrease in blood flow and decreased blood pressure to the glomerulus, then certain physiological changes will occur to increase blood pressure and make sure that there isn't a significant deficit in the amount of blood that's being filtered at the renal corpuscle. At the renal tubule, there are three functions. The two main words here are reabsorption and secretion. Reabsorption and secretion. So essentially, you want to look at it from the perspective of the peritubular capillaries. So essentially, not shown on this image, but essentially the capillaries that will surround the entire tubule. There was a slide that showed this really nicely earlier on. So from the perspective of the peritubular capillaries, you're going to have either reabsorption or secretion. Once again, from the perspective of the peritubular capillaries, you're going to get reabsorption and or secretion, either or, okay? And when you're reabsorbing from the perspective of the peritubular capillaries, you are getting back from the renal tubule, what you still need as part of the blood. You are reabsorbing what was lost to the tubule at the glomerulus, because you still need this sodium, this potassium ion, this calcium ion. You're going to get reabsorbed. These ions are going to get reabsorbed back, returned to the bloodstream. This happens for useful organic nutrients that enter the filtrate, and then most water is returned to the blood here. 90% of water is returned to the blood by reabsorption. The other function of the renal tubule is to secrete waste products that did not properly get filtered out of the renal, that did not properly get filtered out at the renal corpuscle. So a good example of this is medication or toxins. If you want to get it excreted through the urine and get it out of the body, you need to make sure that it enters the urine. So in secretion, what happens is these waste products get put into the renal tubule. Once again, it gets put into the renal tubule and pushed out of the peritubular capillaries so that these waste products can become a part of the urine. So now what we're going to do is highlight the segments of the renal tubule and categorize what happens in each section. So proximal, closest to the renal corpuscle, is proximal convoluted tubule. Most reabsorption of nutrients and ions occurs here. In the distal convoluted tubule, last stop, last opportunity for you to change the components of your urine is at the distal convoluted tubule. Medication and toxins are secreted here from the peritubular capillaries. And I'm going to give a quick shout out to aldosterone, because that's one of these steroid hormones. That's remember the poster child of mineralocorticoids that were secreted from the zona glomerulosa of the adrenal cortex. Remember that way back when? This is where aldosterone will go, is a distal convoluted tubule to confer its action. And as preview, aldosterone is activated in response to renin. So again, more on that later. Let's talk about this loop. This loop is called the loop of Henle. It's also known as the Nephron Loop. This loop dives deep into the renal pyramid, which is part of the renal medulla. Here, there's a concentration gradient that will influence the concentration of urine. All right, here is basically everything I said in image form. So reabsorption at the proximal convoluted tubule, secretion at the distal convoluted tubule, and movement of water and some sodium and chloride at the loop of Henle. At the collecting ducts, you can only change really water, and then urine is going to make its way to the urinary bladder for storage. Here is those terms, that term I was mentioning before, a cortical nephron versus juxtamedullary nephron. So most nephrons are cortical nephrons located mostly within the superficial cortex of the kidney, so in the renal cortex, and then the remaining 15% are found next to the, are found deep in the renal medulla. The peritubular capillaries connect to the vasorecta, and the vasorecta is basically an anastomosis of an artery and a vein. And we'll be able to talk more about why that's important for the loop of Henle in a later slide set. To show you what the vasorecta looks like, this is it right here. And as you can see, the vasorecta is an anastomosis. So if basically a mixing of red artery indicating oxygenated blood and blue vein indicating deoxygenated blood. I actually have no idea why there is this image over here. So consider that entertainment for Friday afternoon. And this is actually where I'm going to cap it for today. We will begin Wednesday by talking about the filtration slits, because this can be a bit of a doozy. Are there any questions about today's material?